in different places, and our gender clinic sort of evolved out of many people providing gender affirming care in different places who realized for certain patients, it would like many things in medicine, when you've got lots of people who are necessarily involved in care, it sometimes is better for all of you to be in the same place so you can exchange ideas and just kind of provide better care, right? We know that multidisciplinary care for lots of things often provides better care. And sometimes, especially for more complex conditions, it's helpful when that multidisciplinary care occurs in the same place. So, gender affirming care, honestly, is what any patient would want, right? As a patient, you want your physician to hear you tell them who you are, what's important to you, and what you want from your healthcare. Now, obviously, your doctor knows a lot of the medical things better than you do as the patient, but at the end of the day, your provider needs to hear who you are and respect you for who you are. And obviously for gender diverse patients, because I think now what we're seeing more is not just transgender patients, but gender diverse patients. So those that identify as trans, as well as those who might identify as gender non-binary or gender fluid. And what those patients need is for someone to ask them who they are, acknowledge who they are, and affirm who they are. And I think a lot of times, unfortunately, what some of the press or those who perhaps are worried, scared, anxious, unfortunately, just prejudice against providing affirming care, they assume that providing gender affirming care means that you are someone who was designated female at birth. You walk in the door, you tell me you're a boy, and I hand you a vial of testosterone and I say, go forth, right? And I think the reality of gender affirming care, honestly, like all things in medicine, is different for different patients. So for some of my patients, it just means they walk in the door and they say, hey, I know that according to my chart, you would call me Sally and use she, her pronouns. But honestly, I feel like my name is Bill and I use they, them pronouns. And that may be all that they need to feel validated. For some patients, it may be more than that. But for a lot of patients, I don't think it's this, again, I think people have created this vision of what gender affirming care is. And all it really means is I hear someone for who they are and I respect them for who they are. And I'm thinking back to this experience I had on Friday, taking care of a patient who wasn't even gender diverse. She was just a teenager who had come in for period problems. And I walked in the door and tried to say what I've tried to get used to saying to everyone. Hey, my name's Dr. Romano. What name do you use? And she was like, wow, nobody's ever asked me that before. And she just thought it was the coolest thing. And she was cisgender. And I think she used the name that she was given, but she's like, oh, I didn't even know that was an option. That's, so, and obviously with gender, it's not like, oh, somebody suggests it. And I think that's what it is. But I just think people like to be acknowledged for who they are. And this girl thought it was awesome that I sort of asked that. So, I lead all of my visits to say, hey, my name's Dr. Romano. What name do you use? I don't always ask about pronouns and gender right out of the gate because like with a lot of things in adolescent medicine, we find that for some patients, at least at first, they may be less comfortable sharing that in front of their parents. And they may need me to sort of work with them to have those conversations. But again, gender affirming care means at any age, I hear you who you are and I respect that and sort of see you for who you are.